Good afternoon, everyone. Welcome to our healthcare claims subgroup overview. My name is Jackie Leiser. I'm a manager with CAQH Core, and we're excited that you're all joining us this afternoon. Before we go ahead and get started, I'm just going to go over some quick logistics for today's presentation. You can access our webinar materials after the presentation. We'll send out an email with a link to watch the video as well as a copy of the slides. But you can also go ahead and download the slides right now from that handout section on the right side of your screen in your GoToWebinar menu. If you have any questions for our presenters today, you can ask them at any time using the questions panel, again, on that right-hand side of your screen. We will have time for a brief Q&A at the end of today's talk. With that, I'm going to go ahead and hand things over to my colleague Pete, who will walk you through the agenda.
Thank you, Jackie. Appreciate it. Welcome, everybody. We're looking forward to a great discussion today, full of content about healthcare claims and the work CAQH Core is doing on the subject. Understanding that there's some folks on the line that may be familiar with Core, others maybe not so familiar, and industry context is always helpful. We're joined by a guest who is supporting Core and its initiatives in the coming months. As we turn the slide here to today's speakers, again, my name is Peter Benziger, and I'm the Senior Manager of the Core team supporting this topic, healthcare claims for CAQH Core. We also have Randy Gable, Ohio Health Senior Director of Revenue Cycle, and Bob Bowman of CAQH Core. Gentlemen, I'll let you introduce yourselves.
Go ahead, Randy.
Okay. Hi, everybody. Welcome. I'm glad to have you here today with us. I am Randy Gobble, Revenue Cycle Senior Director. I've been with Ohio Health for just over 13 years now and served lots of different roles in IT and also Billing Senior Director and now Patient Access Services Senior Director.
Great. Thank you, Randy. And I'm Bob Bowman. Been with CAQH Core for almost 15 years and in the industry since the mid-90s, I think. So lots of experience with EDI, interoperability, the standards, and health insurance. So with that, I'll hand the call back over to Pete.
Yes. Thank you very much, Bob. We're going to start with our CAQH Core overview. And I believe the first slide here is the mission, vision, and industry role, Bob. I feel like you might be best suited to speak to this one with your background on the Core team and the like.
Yeah, definitely. And especially for the new folks that have joined us this afternoon, we are a coalition of the willing, right? The folks that want to work together to resolve some of the more pain points related to administrative and clinical data exchange, interoperability, and standards. How do we roll in new standards or the existing ones and make them more efficient, both for providers, payers, and consumers? So we CAQH Core acts as that facilitator. We are the round table. Everyone comes around and talks about these problems and then potential solutions. We've been quite successful over the last 20 years. And so HHS has designated us as the operating rule authoring entity. So any of those HIPAA mandated standards that exist out in the marketplace and out in regulation, we are the organization, and that our participants come together at that roundtable and discuss what those solutions should look like. Again, trying to build more efficiency, accuracy, and effectiveness to ensure that we get all of the business wins out of those transactions. Again, we are multi-stakeholder even within ourselves. Our organization, our board is made up of both providers, vendors, clearinghouses, SDOs, all the big ones, X12, HL7, NACHA, and NCPDP, and WEDI. You'll hear more about those as we progress too. So on the next page, you'll see that we actually have a whole list of our participating organizations for you. So hopefully if you're not part of this list and you want to become part of that list and work on claims and the problems and experiences that you have with claims today, come join us and be part of this list. But it is important that we do have a lot of participating organizations from across all the different silos. And if you're not on here, or if you're not, your type of organization is not on here, hopefully some of the associations are getting that feedback from you and participating in your stead. So we do want to make sure that we do have that multi-stakeholder approach as we define what operating rules best resolve some of these issues and problems. But what are operating rules? Operating rules on the next slide are defined as the necessary business rules and guidelines for electronic exchange of information that is not defined by a standard or its implementation specifications, right? The official ACA definition. So with that definition, it really helps put some context into what we do, right, and how we work. And operating rules are in many other industries: finance, transportation, retail services, all use operating rules to help exchange the data and actually define what the data might be. Many standards allow for lots of data to come through, like drinking from a fire hose, when in fact, perhaps the provider and health plan only need a certain subset of that data. Or it's been implemented to such a small stream, the provider or the health plans might need more of the data. So the operating rules help switch the levers on and off of that data flow to make sure that the business interaction can really take place. So again, those common expectations for electronic data, the exchange of the data, allowing the providers and health plans to work together to identify the right data, all of that helps address some of the issues that we have with the operating rules. With that, maybe I'll break here and ask Randy a question. You've been in your role for 13 years, and looking at this, the ACA came out 13 years ago. So you've been here for probably the implementation of operating rules and standards and new things coming in. How has this impacted Ohio Health in your role?
Great question, Bob. For us, operating rules help us have an even playing field, if you will, across some of our different health plans. Certain HIPAA standards or certain 277, 270, there's certain standards that occur, but within those standards, those rules help us to mitigate some of the confusion that we have within our organization of saying, okay, well, this health plan does it this way and this health plan does it that way. Well, then we have to create processes in place so that we can know how to work with the different health plans. These rules help us, standardize some of those differences, and makes it super easy for us, if you will, to work with our health plans.
Perfect. Thank you so much. And I think on the next slide, you'll see that, and maybe as a transition into our content for today, last year in 2022, CAQH Core did a lot of identifying of opportunities. We did environmental scanning, industry surveys, we launched advisory groups. We looked at where some of the bigger pain points are and some of the real abrasion is between providers and health plans. And then what can we focus on this year in 2023 as a rule development year? You see there at the bottom, there's 4 main issues or categories that we will be addressing this year. Healthcare claims, as today it starts our discussion with that. Value-based payments, EFT, ERA enrollment data sets, and an interesting and new project that just was approved by our board in February is the NCPDP and CAQH Core eligibility project. So again, lots of work that we're going to be working on this year, particularly this summer. So if any of these initiatives are of interest to you, check us out, come join us if you haven't, or make sure you sign up for and get your name added to our rosters for these work groups. You'll be seeing some of those requests for participation coming to your inbox, so make sure you fill those out. So again, this year we'll be working on that rule development and those requirements, and then we'll be, as you can imagine, we also have different balloting and approval processes that will happen towards the end of the year. So this helps get the consensus that we drive for, right? Everyone has to approve, everyone has to, there's certain levels of consensus and quorums that we try to ensure that we get so that everyone can move kind of lockstep in the next approach for the best, again, the best solution and implement the operating rules for those standards and the exchange of the data, meeting those business needs. With that, I'll hand the call over to Pete to launch us into really the content for today on claims.
Yes, onto the content for today. Just going to say that between the two of you, we're grateful for the background. We have the history and then the perspective of how it gets implemented in industry. But let's turn the page here, where I believe we have a summary of what we found in the environmental scan focus groups that Bob mentioned held across last year. For reference, this is really a layer deeper, if you will, of the section that Bob just pointed out, the identify opportunities portion of that rule development process. And again, we did conduct research thoroughly across the last 12 or so months, and heard feedback from a number of different stakeholders in the industry. Industry experts were telling us that the 277CA claim acknowledgement, for example, is an extremely useful tool, but the guidelines established by X12 in this instance are followed differently between health plans, a little bit to the point that Randy mentioned. Generally speaking, there are folks in the industry who think that coordination of benefits can be ironed out, more streamlined and improved at a high level. And telehealth is another topic that we all experienced a rapid increase in its use shortly after and during the COVID pandemic. So payers, providers, vendors alike, we're not entirely certain we understand how to place of service codes, for example, and ensure that providers in that specific instance are getting claims sent to the payers cleanly. So Randy, I know that you've seen a version of this slide in the past, and we've gone back and forth of what you think about certain topics, but how do these industry sentiments resonate with you or your colleagues at Ohio Health?
They resonate clearly with me. I would suggest everyone get engaged. I see that we had 36 unique participants, but I will tell you, the more input from folks, the better we are. I take telehealth as an example. We're struggling right now. During the pandemic, the start of the pandemic, everyone transitioned to telehealth. It was the way to go. We had to get there. We went from 5% of our visits being done through telehealth to almost 65 to 70%. Well, now that's all unwound. It's come back down. We've got health plans that we're working with. They're saying, oh, no, we're not going to cover telehealth. We've got others saying we were encouraging you to continue using telehealth. And from my perspective as in registration, it's hard for a registrar to know or a scheduler to know when a patient is presenting whether their insurance is going to support telehealth or whether we should push them toward a telehealth visit. And so we're going on back on the default. The default is face-to-face, and that's an advantage that we had through COVID that we're now losing. So having opportunities for us to discuss how we could better do this or how we could create rules for this is going to greatly benefit our patients, first off, and second off, make it simpler and easier for us to work together on how we get reimbursed and how we provide that service for our patients.
Thanks for the guidance there. I think it's additional context that we heard from research and you explaining how it impacts your team at Ohio Health is valuable as well. I believe the next slide here is a short list, a more formal list of, maybe it's the slide after this one. I'm mixing up all the slides that we've looked at more formally of the content areas that we're focusing on as opportunities to leverage a focus on the 837 to improve. So I don't need to read them all aloud there, but I think the takeaway is that we heard in our research that these are topics for the subgroup to tend to. Very quickly, I'm going to go through the so what of each of these because Randy, we appreciate your perspective again here. I'm going to skip past telehealth place of service assignments. I'm not certain that I could say it any better than you did, Randy. But for coordination of benefits there, the thesis generally is health plans and providers alike sometimes have to call each other, for example, or communicate more broadly with the patient to understand a basic item like who is the secondary payer, how much of a service is the primary versus a secondary going to cover. And if we look at this through the lens of an operating rule in this instance could specify a minimum set of coordination of benefits related data contents to include on a claim and avoid those types of conversations. For value-based payments, I'll stay pretty high level here. The thesis is value-based payment arrangements, very generally speaking, are not only increasing in prevalence, but the nature of a value-based payment arrangement, payers and providers must stay coordinated on a patient's well-being, which we know requires the submission of additional diagnoses to really understand what's going on with a patient. And there are different methodologies that exist, if you will, for sharing those long lists in some cases of diagnoses between providers and payers, again, all with the goal of keeping a patient healthy. Finally, we have claim acknowledgement there at the bottom, and it could be an extremely useful tool. That's the 277CA. but we understand from our participants that the information that comes back and the 277CA response can be hard to interpret because the codes can be used differently, have different definitions, if you will, depending on the health plan that is sending them to you. So, Randy, of these topics, maybe not even one that's listed on here, but looking at it through the operating rule perspective, has there been one that's been a pain point to your team lately?
I'm not necessarily a pain point recently, but in the past 277s, and we haven't moved to the 277CA, working with our vendor to do that. But with the 277, we spent a lot of time mapping those messages back into our EMR so that we could take some of the burden off of what our follow-up staff was doing on trying to determine what the claim, the acknowledgement was, what's the status of the claim, what do we need to do. And so with that mapping, that's been great. That's been able to take that information in. And we worked with our different health plans on the information they're sending. You know, could you send this? Could you add this? Could you take that away? Again, having some rules behind that so that we don't have to have that negotiation with every health plan, and vice versa, having the health plan say, why does this provider want it and this provider doesn't? So it'd be nice to have some better rules around that. And I think the 277CA is a great place to start.
Yeah, one of the phrases that you used that I certainly keyed in on was mapping, number one, and the burden to your back office of understanding which payers want what and what the different codes mean. So appreciate that. And got another question for you. Not going to let you off the hook that easy, but looking to understand if from an operating rule perspective of the items that we have on the list here, do y'all follow a best practice that correlates with one of these areas? Might just be me, but Bob, do you also see a frozen screen there? We got you back, Randy? We have Bob, we have you on mute there. And it looks like Randy's going to join back in a second. But,
well, maybe I can, as we're waiting for Randy. Oh, there you are. Can you hear us okay? I think you're still on mute, Randy.
Yes, I was. I lost you for a minute. I had to reconnect. I'm back now.
No worries.
We were asking Randy if at Ohio Health, it's a big operation. Do you follow any best practices that you're particularly proud of related to the rule development opportunities we have on the screen?
Proud might be too strong of a word. I'm very happy with the work that we did about authorizations. I know that was always a challenge, and it's still a challenge. We're working through tightening up the return time of a request for authorization, and that has been an improvement since the time we started with CAQH Core, and I guess that would have been over 2 years ago now. But yeah, those are the things that we get benefits from working with you guys on, and we're working collaboratively with vendors, health plans, other providers, what are their needs, what are their wishes, and can we do stuff together so that we're not each reinventing the wheel each time we try to make an improvement.
I think to the extent that operating rules can standardize conversations between vendors and health plans and the like, can certainly see a benefit to any provider organization. So we appreciate you walking us through that. Let's go through the scope, timeline, goals, et cetera, of our healthcare claims subgroup. It's actually launching tomorrow at 2 p.m., I want to say. And we actually have an email address that will pull up on the screen so that everybody, if you'd like to participate, can reach out. But very quickly, the scope of the subgroup is truly data content focused. How can we, across the industry, align on specifications to the 837 standard that support the goal of the subgroup, which is to inform what an operating rule will look like that's going to benefit industry, and we're hopeful that it will benefit industry because of the long list of different organizations that are participating in rule development. So we have 4 meetings on the calendar to date. We're looking to schedule a 5th. Other items that are on the screen that I'll define for you. We have straw polls, and that's where we solicit feedback from subgroup participants after each meeting on the topics that we discuss. The subgroups, the straw polls, generally speaking, are the detailed feedback that we use to build operating rules. It's where industry puts their opinion on paper, digitally, of course. It's an online form to direct what operating rules will look like. Just so that we're all aligned on what a lot of these phrases, key items, et cetera, mean. And we also have a call to action for anybody on the line. From the subgroup perspective, taking a little bit of a selfish approach here, Randy and Bob, the takeaway that I would like to communicate in so many words is to be sure to email us if you want to contribute or participate in the rule development process. So, Bob, I know that you also have some items you were looking to communicate from a call to action perspective to the group.
Yeah, definitely. I think that not only is the rule development really important to continue to foster kind of industry goodwill and make sure that we're looking at the right problems and finding the right solutions for the broad industry and all of the unique participants that are part of our industry. But CORE has gone the step further, and we also have a certification program. So if you're a health plan, a vendor, a clearinghouse, and you have implemented and remediated your systems with the requirements of the operating rules, you can actually go through CORE certification, validate that your systems and applications and software meet those requirements, and then we do award a seal. So you can use that as part of your marketing package that, hey, we do meet and exceed the core operating rules, the data content, the requirements, the infrastructure, all of the different types of services that we provide in certification. That seal can go a long way in recruiting next clients, in recruiting the next provider client, or the next health plan client. So that's something that we also have done. Another key component of what we do at CAQH more broadly than just CORE is we run ROI assessments, we run pilots, we assess the industry on how far we have come as an industry with the publication of our index, for example. So we look and see how the actual implementation of the operating rules takes place. How hard is it? How much does it cost? Where are the resources? Where are the dollars? Where are the timeframes? Where are the milestones? And then share that with the broader industry, so you know exactly how big the breadbox is when you tackle these projects yourself. And we can help categorize these into, hey, this is a large national health plan. It takes this much. Here's a regional health plan. Here's a state-based plan. Here's what a large vendor takes to do. Here's what a small vendor takes to do. So we can be pretty confident when we say that before core connectivity, it would take 3 months to connect and share the data. With core connectivity, it takes less than 2 weeks to implement core connectivity and turn in and plug in those vendors into your system. So those are the real types of real world knowledge and data points that are really helpful for people who have to make decisions when they have to remediate systems, plug in new vendors, connect with new health plans, connect with new providers. So obviously I'm a big advocate for this. We know Randy is, he's really helping us out. We also have other co-chairs that can help us out tomorrow afternoon. Really trying to make sure that we have that broad industry support and feedback. So again, like Pete and Randy, I would also advocate, if you're not involved, try to get involved. And if you can't do personally, come in and complete our surveys, help us work out. So Randy, I know you've been working with us for a couple of years and have seen some real bright spots, hopefully, in that relationship.
I have. And I totally echo what you're saying, Bob. Be a participant, be an advocate, do the straw polls. The information that Pete and Bob and the other folks of CORE do is great information, but it's our information. They're going to help guide and lead us through this, but if we don't participate, then the information isn't going to benefit as much as it could. So I've talked to a few other organizations into joining, and I continue to do that when I meet with them. If you're not currently a member, become a member and participate in the CORE teams.
Great. Thank you.
Thank you both very much. I think that's at this point, we can turn it to Q&A to the extent that any questions have been submitted.
Okay.
Give us a second to see what questions have come in.
Pete, and I can remind everyone, I don't see any questions up just yet, but if anyone would like to submit one, you can do so on that right-hand side of your screen. There's the GoToWebinar menu and that questions panel. We do have a few minutes if anyone has any questions for our presenters today. Not seeing anything come through.
That's all right. I think that it's easy to tell how, or we hope it's easy to tell, I should say, how excited Randy, Bob, and I and the rest of the team are to begin the healthcare claims subgroup tomorrow afternoon. If you have any questions, our email is right there, smack in the middle of the page. Don't hesitate to reach out. We are very friendly and we love talking, if you can't tell. So we'll touch base upon y'all reaching out. And I think otherwise, it's have a great rest of your day. And if you're planning to join for all 30 minutes, you've got 3.5 minutes back.
Thanks, Pete. We had one very high overview question come through that was just how can we learn more about CAQH? And just so that everyone is aware, please feel free to visit us, caqh.org. But like Bob and Pete mentioned, if you are interested in participating in any of the initiatives that were discussed today, please feel free to shoot us an email. It's core@caqh.org, and someone on our team will get back to you as soon as we can. So we look forward to hearing from you all. And I think on that note, we do have some additional upcoming events that CAQH Core will be presenting at. So next week we'll be at HIMSS in Chicago. So if you're there, please stop by. We'll also be presenting at the National Dental EDI Council later in April. That's April 25th. And we'll also have a webinar similar to this one to discuss our upcoming value-based payment subgroup that's launching at the end of April. And that webinar will be on May 3rd. So please keep an eye out for those emails and stop by if you are at any of our upcoming conferences. All right. I think with that, yeah, thank you all so much.
Thanks,
Pete, Bob, thanks for joining today.
Bye, everybody.
See y'all. Have a great day.